Hello, everyone, and welcome to Picoway webinar sections. I'm Peggy Lam, Product Marketing and Medical Affairs Manager from Candela APAC. I would like to introduce our speaker today. Dr. Wichai Hongchalu is the Chief of Dermatology Unit of St. Louis Hospital in Bangkok. He received both certificates and clinical fellowship in dermatology and research fellowship in laser and photomedicine respectively from Harvard and the Department of Energy in the United States. Also, he got diplomas in both internal medicine and dermatology from University of London. Now he is the fellow member of American Society of Laser Medicine and Surgery. Just a kind reminder, this is a recording webinar. We will have 15 minutes Q&A sections at the end. Dr. Wichai, may I invite you to start now? Thank you.
Thank you, Peke. Thank you, Candela, for inviting me to share my experience on how to use the full wavelength or Picoway system for the treatment of pigmented lesions. When we talk about the Picoway, why we concerned and interested in Picoway? Because we have 4 different types of pulse width or pulse durations. You need something that near 450 to 200 picosecond. Why we need that range of picosecond laser? Because we know that stress relaxation times of the melanosome is around 200 to 400 picosecond. Here you can see that Picoway at 1064, it provides you 450 picoseconds. When you mention about wavelength, I want you to imagine about what is the pulse duration of that particular wavelength. If it's, I mentioned 532, I refer to 375 picosecond. If I talk about 730, you must think about 250 picosecond. If I talk about 785, you think about 300. Not because they want to produce something that like 755 of the competitive system. Actually, 755 of the something here like 750 picosecond cannot compare with 1064 of 450 picosecond here. So not because they produce 730 or 785 to have similar property like 755 of other system. No, because we want this pulse width. The pulse width here is amazing. It's really short because you want the real photo, selective photoacoustolysis by the pico laser. I will tell you that all the systems here, they're all different. They're not the same at all because the pulse duration here are different. So now we're going to talk about Picoway, which gives you the shortest pulse duration in the market right now. This is the Picoway system that provides you a zoom handpiece and fractional handpiece. When I buy this machine, it's come with only 1064 and 532 wavelength, which is giving you 450 and 375 for both zoom handpiece and fractional handpiece. Zoom handpiece, you can adjust the handpiece from 2 to 10 millimeter spot size. So when you come to look at pigmented lesions, whether it's going to be melasma or it's going to be lentigens, you have to know the real enemy. The enemy is melanosome. You want to destroy melanosome. The study here showed the dark skin has the mean melanosome, the large size of the mean melanosome. If you look at the Caucasian, it has a smaller mean melanosome size. This is probably contributed by the composition of the type of melanosome in each individual ethnic skin type. There are 2 types of melanosome, individual melanosome and cluster melanosome. The cluster melanoma is the small, tiny melanoma that stay together. The individual melanoma is rather big. It's larger than cluster melanoma. And you can find all these melanosomes distributed in all keratinocytes and melanocytes. So the perfect spot size that you want to the handpiece to treat melasma should be the zoom handpiece, because you're going to destroy all layers of the melanosome here. If you look at the property, the percentage of the individual melanosome in dark skin, it's almost 90% of the total melanosome. So the large size of melanoma contributed to the average mean melanoma size in dark skin. White skin has more smaller chromosome melanosome here. Asian has quite similar percentage between the individual and cluster melanoma. But in Asian skin itself, you can imagine we have dark skin as well, like Polynesians, like Thai, like Malay. You have also very white, like skin type 1, 2, 3. In Chinese skin type, in Taiwanese, in Korean, or in Japan. In my country, Thai, we have all skin types from type 5 to type 1. So that's why we need to know the melanoma size. And this will give you some idea about what is the selective stress relaxation time for particular melanoma. Rox Anderson and John Parrish, when he introduced the selective photothermolysis theory, in his article also mentioned about stress relaxation time of melanoma. Calculated is around 200 to 400 picosecond. If you think about melanoma in average, it's about 1 micron. The term selective stress relaxation time should be around 300 picosecond. So when you consider the pulse width of the laser that want to destroy the particle of melanoma at 1 micron, you can see that if you use 250 picosecond of the Picoway, the whole energy will fit in the stress relaxation times. If you use 375 of the Picoway, which is around 532 nanometer wavelength, it will probably about 45% of the energy fall into that stress relaxation time. If you use 450 picosecond, that is 1064 wavelength, it will fall into stress relaxation time about 5%. Not to mention 750, you can have only 2% of the energy fall into the stress relaxation time. And with the kill switch, you have only 0.1% fall into this stress relaxation time. Now you will see that why we need the short picosecond laser pulse that should be around 200 to 400 picosecond domain. This is a melasma that failed to respond to kill switch laser. She has white skin, but she got worse. You can see this. This is a patient who failed to respond to Picosure at 700 picosecond laser. So not every picosecond are the same. You can see she refused to treat by my laser as well, because she said she's not good at not had a good response with pico laser before. But then we will tell you how to choose the right parameter for melasma by the treatment of Picoway. Remember, you not treat all melasma. You need to select the melasma patients. Melasma that fail to respond to tranexamic acid is ideal. But patients who want to enroll into the treatment have to be treated by tranexamic acid first. And the patients who had rebound melasma or confective melanosis from key switch toning or from other light source like IPL or Fraxel or any energy-based device. And the patient who not respond to strong bleaching agent like hydroquinone. All these are good candidate for a treatment with pico laser. And remember, we start with 1064 standard handpiece of the Picoway plus 532. This will give you 450 and 375 picosecond laser. When you see this type of skin, dark skin type 5, this type 5, you imagine it will compose of individual melanosome, 90%. You just treat the individual melanosome. You must use the longer pulse, like 750 in Picoway. It's matched with 1064. So with high energy, with average hertz, 5 hertz, you can clear melasma quite easily in dark skin. Why? Why? It's easy to produce longer pulse, but only one pulse duration and one wavelength can fix this melasma, and the results stay longer than 1 year, stay for 3 years for these patients. One of the character of the response for melasma to Picoway is it lasts for a long time. I can ensure you that at least 30% of patients can last more than a year. This is another patients who have dark skin in type 5, have pigmentations, and it responds with just one pulse duration of 1064, and the result lasts for a long time as well. But there are certain group of the patient who not respond with only one pulse durations. When you listen to any lectures of the pico laser with melasma, if you ask what machine you use, what pulse width you use, you have to ask about pulse width. All pico are different. How many percent of the patient respond to your pico laser? This is a patient who not respond to 450 picosecond alone. You need to add something else. Accidentally, I found that you need to add 532. Then when you add 532, from my idea, you have to fix the cluster melanosome as well. So longer pulse for individual melanoma, shorter pulse for cluster melanoma. This patient have long-term remission for more than 2 years, so far 3 years already. And you can see she got worse. She meant the history is this patient has no melasma before, but after treated by Q-switch toning, she developed melasma. And then that's, it's difficult to treat. Then this patient can fix with 2 pulse durations. And this is another skin type 5, which have a good response with 2 pulse width as well. Result lasts long, and this also skin type 4 with 2 pulse durations. Then this is the patient that failed to respond to Picocure. Yeah, the 750 picosecond laser. So she refused to be treated by Picoway, but finally I can persuade her to do it. And now she have a long-term remission for more than a year. She used 2 pulse durations for treatment of by the Picoway. Then there's still some group of patients who not respond to these 2 pulse durations. So at least about 50% of patients respond to pulse duration of 450 and 375. Then I come up with, why don't we do it with high frequency regimen? High frequency regimen is 10 Hertz. Why not? Because we have ultra short pulse picosecond laser. So we have high peak power. We should achieve the selective photoacoustolysis. And if we do high Hertz, what's happened? This is a graph that shows that ultra fast picosecond laser can give you more stress intensity in that particular particle you want to destroy. 6 Hertz have less stress intensity than the 10 Hertz. So with faster repetitive rate, you will create the stress intensity in the particle. This is the example. This is a patient who've been treated by 400, the same 532 and 1064 without any improvement after 3 or 4 treatments. Then I come up with 10 Hertz with lower energy to reduce the energy fluence down to 1/3 or 1/4 of the low Hertz fluence. You can fix the problem easily, and the results give you long-lasting results. This is a whiter skin patients. So I try to do more Hertz, more passes with shorter pulse durations for whiter skin, because we know that in this group, they will have more percentage of the cluster melanosome, which is small size melanosome. This is another patient who have rebound melasma from Hughes laser. You can see with low Hertz, I can get this kind of improvement only, cannot get further, even how many pass, how many treatment I want to do with these patients, with this parameter. Then we come up with fast, ultra fast, high repetitive rate with short and long pulse duration to get this kind of further improvement. So this is a trick that you can play with melasma. All melasma are not the same. Then Picoway launched a new handpiece. It's called 785 nanometer handpiece. But actually, I would like to say it's 300 picosecond handpiece more than 785 handpiece. This is amazing. This is the average of the selective stress relaxation time of the melanosome. And with this particular wavelength, you have benefit over. Other thing is the 785 absorb only with melanin. It's not absorbed by blood. So the energy will go down deep, and you can use for the treatment of dermal melanosis like nevus of Foley, nevus of Ota, which I will show you later on. And just 6 months ago, it launched the new 730 nanometer handpiece, which is the shortest pulse duration in the world. I would like to say this is called 250 picosecond handpiece rather than 730 handpiece. I want to emphasize on this. This wavelength gives you the highest melanin absorption, higher than 785, and lower hemoglobin absorption. So then we come to look at the tissue laser interactions. This is a patient have skin type 4, and after treated by the parameter of previously I talked about 450 and 375, no further improvement. So I combine with 785 with low hertz to get this kind of improvement, no further improvement. Then we come up with everything short, out the short, 785, 300 picosecond, and 5 to only 375 and 300 picosecond treated with high hertz. You get further improvement in this case. And the result, long lasting, 11 months clearance. Actually, it should last longer, but she just visit me again. Okay. Uh, then this is a white skin who come for just one pulse duration. I treat with 300 picosecond pulse duration or 785. High energy, high hertz. You can see long lasting result for 18 months. The same. Yeah. Then, as we mentioned that the 785 itself, 785 itself has a big advantage that you can deliver energy deep into the dermis without blood absorption. This is a dermal melanosis that treated in type 5, and after 4 times it's clear. This is different white balance because I asked her, she said she's fine now. So I asked her to send the picture through the mobile phone. So actually the skin color should be like this. So this is the summary that I want to summarize. So how to choose the pulse width, how to choose the fluence for melasma treatment. For dark skin, as you know, the main component of melanosome is large size melanosome. It's easy to use 1064 450 picosecond laser. It's a good handpiece, good perfect tools. But remember, if you want to treat every melasma patient, different ethnic group, different color of melasma, you need to combine short and long. 450 with 300 or 450 with 375, or you want to combine short and short, especially for whiter skin. Short and short is important. For very light skin, like skin type 1, type 2, I prefer 300 picosecond and 250 picosecond. For the dark patches, the increment of the fluence may be needed. Think about when you want to break something with acoustic, with momentum, you need to increase energy. And you may need longer pulse if the skin is dark. Sometimes when it's extremely dark, no way to do the painting technique. Sometimes you need ablative technique. Picoway with the pulse duration shorter than 300, either 250 or 300, can give the promising result with the ablative technique using Picoway for melasma. Again, high repetitive rates is a method to increase the stress intensity. This is the diagram how you go through this. Skin type 5, dark skin. You start with 450 picosecond, low hertz, or you want to do both together, low hertz plus high hertz. In type 1 to type 4, definitely you want to treat the dark part first with 450. You have to start first treatment. You have to start with 450. Get rid of the dark and large melanosome, and then after subsequent treatment, you can add on some shorter pulse like 375, 300, 250. I do it every 2 to 4 weeks. Even nowadays, I can treat maybe longer interval than that, which I will discuss later on. That's too complicated. The new 730 handpiece just launched. It gives you very short pulse duration, so it gives you high peak power. This maximize the photoacoustic effect and minimize the thermal effect and the risk of the PIH. This is good for benign pigmented lesions. Benign pigmented lesions. If you compare 730 with 785, in terms of improved melanin absorptions, 730 has 30% higher melanin absorption than 785. 530 to 670 wavelength too strong for dark skin type and cannot penetrate as deep as the 730. If you look at the melanin absorption compared to the hemoglobin absorption, with 730, you have 43% higher melanosome to blood absorption than 785. The highest in the graph here, comparing to other wavelength. Then come to look at the short pulse durations. 730 have 70% shorter pulse duration comparing to 785 and 33% more high peak power than a competitor. Remember, we want this, we want pulse duration. There are many, like 755, 600 something. No, we don't care about wavelength. We care about this. Even 1064 in the Picoway system is more superior than other system here. The reaction is going to be different. You talk about pulse durations. This is interesting. This patient have melasma or exogenous ochronosis. This is a patient who treated by the original 2 handpiece, 450 and 375 handpiece without any further improvement. This is something that you need. The real thing, very short pulse duration, 785, 300 nanosecond, picosecond. Then you can see it's lightened the ochronosis. With 785, penetrate very deep and have high acoustic power. Then after using 730, furthermore, I can remove this spot without PIH at all. 730 is very good for removing benign pigmented lesion in dark skin without PIH. The more dark, the better the result. 250 is real short, outer short. This is a patient who have very bad melasma. Look like ochronosis as well. I start a blade. If you get this kind of darkness, I don't think that you can do any toning and get the benefit from toning or painting. You need real abrasions. I abrade this with pico 300 picosecond, high energy, high hertz, and it forms the whitening, frosting. When it fall off, it may have slightly pigmentations that you can fix with this parameter. 1064, 10 Hertz, with the fractional handpiece of 532, 0.2, 10 Hertz. I will talk about this parameter later on. This is a parameter that's very interesting. Pico laser, Picoway, I have a parameter that can solve the PIH by any means, by Q switch, by yourself, by whatever, by accident, by heat. This is the perfect parameter This is a parameter to treat the basal dermal epidermal junction. I will show you later on. After you abrade the melasma, in this case, you have long-term remission. This is 11 months. And then I got a new handpiece. I asked her to come back for more treatment. You can see it's improved this quite dramatically as well. This is a toning, not ablative. Okay, toning the rest of it. Similarly, with 785 ablative, you had this improvement, and then you do some toning with 730. 730 also very good as well to get rid of the recalcitrant melasma. This is another skin type 5 who have a very dark skin, dark melasma. And this thing of this type of darkness, you need ablative. I love to do ablative on this. And if you do toning, I think it's going to take a long time. And this is another patient who have a white skin. And white skin, you know that melasma, the white skin, in white skin, you will have melanosome that's very small. You need short pulse, pulse with 250 picosecond. Suit well with this one. You can see this is the acne scar, not to concentrate. Look at this. Lighten with just one treatment. And you can use 730 to treat in skin type 5 as well in the recalcitrant melasma like this. Then I will tell you about another handpiece that we have. It's called fractional handpiece. They call resolve handpiece. Why you need resolve handpiece? A lot of people, most of application I use fractional handpiece for rejuvenation, but you can use for toning, skin toning as well. The technology here called holographic technology. The fractional handpiece of Picoway concentrate create the LIOB in the epidermis, and actually it has a focusing depth around 500 micron. You can choose to have LIOB lesion here, or you choose to have the damage of the dermis here called laser-induced cavitations, depending on the fluence. If you talk about the LLB first, you know that LLB, if you get into the threshold of LLB, you have LLB. If you increase the energy higher, the lesion will be more superficial. If you lower energy down near to the LLB threshold, the LLB will be situated near the basal membrane zone. So if you want to treat melasma or treat pigmented lesions, you need to treat near the basal membrane zone. So that's rather low energy range of the LIOB fluence range. So one technique that you can play with is repetitions. You want to treat this area, you need to deposit this raindrop to be a storm. The storm of LIOB happening here by increase the frequency called high repetitive rate. This is an example. Patient who treat with 5 Hz with fractional 532s, who have melasma, have dirty skin here, as you can see. And then the improvement of the skin texture and the tone is quite dramatic after 1 month. But you treat only in 5 Hz, I tell you, the results going to stay for 2-3 months and everything will recur back. But if you increase the energy and increase the repetitive rate to 10 Hertz, you have clearance for longer period of time because you bombard with the storm of the LIOB. This is good. And this can be the parameter to treat the basal membrane zone. Like in this case, this is a patient who have PIH from use switch laser to treat reversal poly on aorta. You can see with this parameter I mentioned before, spotly treatment with the high energy of the zoom handpiece plus the storm of the LLB by the fractional handpiece, you can clear this PIH. So now you have another weapon, very important weapon to fix the and manage the PIH, any kind of PIH. Okay. So the next I will summarize the pulse width and selection influence selection for benign pigmented lesions. For dark skin, you can use 730. I myself, I love 730, 250 picosecond. It's a perfect tool to remove benign pigmented lesion in dark skin, type 5, type 4. You can use it for lighter skin as well, type 1, type 3, by using this 730 handpiece. But you may require more treatment visit, maybe 1 to 3 times. But with for the treatment of dark skin, one shot is enough and nice. With the lighter skin, I love 532. There's a good absorptions, because not the good, and actually 730 has more good absorption, but actually 532 here the fluent is rather high, really high. It's good for remove the benign pigmented lesions. The endpoint for different pulse which are different according to my experience. For longer pulse durations, 750, your endpoint is grayish, rather grayish color. But for the shorter one, you need whitish frosting. Again, don't remember trying high repetitive rate. This is a good tools to remove, good technique to improve the stress intensity. This is an example that I remove antigen in dark skin without PIH. For patients who have dark skin and who have lentigens, light, rather light comparing to the skin itself, have low gradients of the, the treat the lesion to the skin type. This is difficult to treat by other means. With 730 handpiece, you can have this thing disappear in one time. Or you want to gradually repeat more and more to have improvement in this surrounding area can be used. You can use this type of 730 handpiece as well. For white skin, who also has a nice and no PIH, improvement of confetti pigmentation here. You can see improvement of lentigens by 730. This is the acne just coming, so let's concentrate. These things happen in one time. Probably she will need one more session. I just give you an idea that you can gradually remove this pigment without much downtime. This is from the dermatoscopy I show you on my hand, on my arms. You can see we can treat lentigens removed nicely without pigmentation. For whiter skin, if you want to remove pigmented lesion, confluent and distill lentigens that 532 is a perfect tool as well. You use it and match with the perfect skin type, you will get a good result like this. So in summary, 785 handpiece provide you 300 picosecond, give a beneficial pulse width on the skin type 5 and type 4 for melasma treatment and used for painting. But it's not as good as 730 for benign pigmented lesion removal. Okay. 730 handpiece is one of the best I ever come across in my whole life for removing pigmented lesions, especially for the dark skin. For 730, handpiece is a beneficial pulse width that you can use for melasma as well, especially for skin type 1 to type 3. And it's the best handpiece for various benign pigmented lesion removal, especially skin type 4 to type 5, with a very low risk. So how to apply? You have to think about repetition rate, low frequency, the type of the skin, of the short pulse picosecond, combination of 2 pulse duration for melasma. Then I will talk about another interesting thing from the fractional handpiece. I mentioned that you can use for heating the basal membrane zone, correct the PIH. I told you already that I use it for rejuvenation, but pore size reduction is one of the consistent application that give you a consistent result by the fractional picosecond Picoway handpiece. Here, one treatment, I show you that the volume of the pores reduced at least 50%, 50-60%. Pore index reduced the same. Pore count also reduced at least 15%. Either large pores, small pores, moderate pores, they all reduce. So in summary, for fractional handpiece, it's good for rejuvenation and pore reduction. Both pore count and pore volume are all reducing significantly by Picoway fractional. So this is about the experience I would like to share. And you need to understand your ethnic skin. You have to understand the proportion of your patient, and then you select the right tools for your patients. Thank you very much. No.
Hi, everyone. I'm Karen, the Product Marketing Manager from Candela APAC. Firstly, thank you very much, Dr. Wichai, for sharing his valuable clinical experience and insights. And in the next 10 to 15 minutes, we'll be addressing some questions that we have received. So Dr. Wichai, the first question we have is that in some of your before and after photos that you share using the 730 and the 785 nanometers handpiece, what would be the spot size that you mostly go for?
The spot size is between for melasma. Normally I use 4mm spot size. For ablative technique, I use 3mm spot size. For benign pigmented lesion removal by 730, I normally use 2mm spot size.
Okay, thank you. And the second question is, we know that there are many different types of melasma, and however, for dermal melasma, what would be your suggested parameters in most of the cases?
I don't care whether it's going to be any type of melasma. I care about the color of the patients and the color of the melasma itself. I treat they all the same. I start with 1064 to remove 450 picosecond first to remove the darkest particle of the melanosome. And for the subsequent session, I will combine. If patients are real dark, I will use 450 or 450 plus 300 picosecond of 785. If patients are rather brown, I found that 532, 375 picosecond and 785 wavelength of 300 picosecond is the good combination as well. But if the patient is really white, like Chinese, 1064 plus 532 also is a good pattern. It's a pattern of the matching between the skin ethnic group and the pulse duration that I want to match with the particular skin.
I see. And also with both handpiece, both the 730 and the 785 currently on hand, how would you come to plan the patient treatment plan in conjunction with the use of both of the handpiece, like which to go first to attempt and then move on to another? How would you think for the planning with both of the handpieces?
For pigmented lesion removal, I think 730 is the ideal. I love 730 because the peak power is real high and the absorption is real high as well. And you can repeat it. Even you do it not carefully, you not PIH, you can use like high repetitive rate of 730 to remove benign pigmented lesion in dark skin and light skin. But for 785, 75 is good for melasma. I don't know because I had 785 for almost a year or two. I get used to it. So I know how to handle it. But with 730, it's very good for melasma treatment of the whiter skin. So I think it's like a tools that you have to master yourself. But the principle is like this.
Yes, and also the next question is that some user recommend to only have like slight whitening or even just lesion darkening as a clinical endpoint when treated with the Picoway system. And we saw in some of your before and after photos, there could be some more whitening as clinical endpoint. Could you further explain the rationale of this immediate whitening in treating the skin type that you're treating?
For pigmented lesion removal,
Yes.
well, a lot of people who try pico laser and remove the pigmented lesion, some of them end up with the darkening of the lesions. For me, I think maybe you not remove the whole layer of the pigmented lesions. It's probably maybe not PIH. So in my applications, I would like to use the high energy enough to remove the whole layer of pigmented lesions. As I mentioned that endpoint of different handpiece is different. Longer pulse duration, you get only grayish color. That's probably enough. But if you look at the grayish color of 450 picosecond, the grayish color, because the longer pulse duration, you may have some form of thermolysis as well. But if you come to shorter pulse duration, that's going to be acoustic. So pure acoustic shouldn't have any kind of the thermal deposit. It should not have the chance to have PIH. So if you use like 250, I start with a strong energy as much as I can. And then it's gonna remove the pigmented lesion completely. This is more, for me, it's more aggressive treatment, but so far I found a good result.
Thank you. And also that's a question more on the skin rejuvenation side. And we have audience that's interested about the pore reduction. And if Dr. Wichai, you have to treat the pore size reduction. Which fractional handpiece will you use, and what sort of parameters and treatment interval would that be?
For the pore size reduction, the best thing is the pico laser. It's simple, it's easy, it's the easiest thing to do by Picoway. The pore size reduction, I will use parameter that the one stop lower than, we call one stop lower than the LIOB fluence. I mean, if you know the IOB fluence is 2 millijoule per microbeam, you just lower one stop, like 1.9, which is the parameter that I found for Asian skin. So with that particular fluence, it's create a good rejuvenation effect. That definitely you will get a good pore size reductions, at least 60%. And you can maximize it by using high hertz. People use nowadays maybe only 5 hertz, and you say you not see good result because you not maximize it.
Sure. And do you have any tips and pearls to suggest to avoid mottled hypopigmentation after any picosecond treatment?
Hypo, you mean hypo?
Hypo, yes.
Well, if you use most of the handpiece that we have has a very short pulse duration. The hypopigmentation, you have to be careful only in 1064, which is 450 is a longer pulse duration. You should, if you want to use the high hertz, you need to lower the fluence down 1/3 of 1/4 that I mentioned before. You not use the standard 1064 like 1 joules per centimeter square with high hertz higher than 5 hertz. That's gonna create hypo. Normally, if you use in other pulse durations, like 300, 250, or 375, the energy go down to fix the small melanosome, the real small melanosome. It's not going to create any hypopigmentation except in the 1064 handpiece.
Yes, thank you. And also, we have another question about treating acne scars. So with the Picoway system, fractional handpieces, how would you approach with the acne scars, and also which type of acne scars do you find it most beneficial?
Acne scar with the Picoway, as I mentioned, you need to use a high hertz. I love both 532 and 1064, but patient may mention that they love 532 more than. That's the subjectively report by patients. So 532's high hertz, you can use either LLB parameter or lower than L parameter to create the LAC parameter. You mix both epidermal damage and dermal damage. That's the technique to treat acne scar. And every type of scar respond well, especially atrophic scar.
Sure. Thank you very much, Dr. Wichai. And so here we will end this webinar. And apology if we haven't addressed your questions due to the time limitation. And you're welcome to contact us after for further inquiries. Again, thank you, Dr. Wichai, for the wonderful sharing, and greatly appreciate everyone for your time to join us today. Have a great day. Thank you.
Thank you.